Meron din po tayong pagtaas sa mga naa-admit sa ating mga ospital, partikular na po sa National Capital Region. Kaugnay nito, kinakailangan po nating unahin ang ating vulnerable population. With the increasing number of admissions in the past week, with bed utilization now at 60% and ICU utilization at 58%, kinakailangan na po nating mapigilan ang banta ng Omicron sa pamamagitan ng pagsunod sa mga bagong protocols para ito sa proteksyon ng ating mga vulnerable at sa ating buong sistema. Next slide. Gaya ng National Capital Region, meron na rin pong pagtaas ng kaso sa ibang rehiyon, katulad ng mga probinsya ng Bulacan, Cavite, Laguna at Rizal. Mula po sa 153 cases a day noong unang linggo ng Disyembre, tumaas na po ito sa 1,400 cases a day sa bandang dulo ng nasabing buwan. Kailangan po nating tandaan na ang pagtaas ng kaso sa ibang rehiyon ay hindi magiging isolated case. Ito po ay nakakaapekto sa lahat ng kalapit na rehiyon. Kasama po dyan ang NCR Plus at ang kabuuan ng Luzon na may mas malaking pagtaas ng kaso ngayon kumpara nung Delta experience natin noong September 2021. Next slide, kagaya ng sa naging trend pataas sa NCR, narito naman ang mga probinsya at cities na sumailalim sa Alert Level 3 dahil sa mataas na bilang ng mga kaso. Ang may mga mabababang vaccination rates ay kinakailangang maghanda para sa kanilang hospital capacity. 18 out of 99 areas ang sumailalim sa Alert Level 3. Karamihan sa mga ito ay may less than 40% vaccination rates. Ang mga provinces at cities na kasalukuyang nasa Alert Level 3 ay ang mga sumusunod: Lanao del Sur, Negros Oriental, Cebu, Zamboanga del Sur, Northern Samar, Quezon Province, Camarines Norte, Bohol, Ifugao, Western Samar, Davao del Sur, Cotabato City, Negros Occidental, Antique, Nueva Vizcaya, Camarines Sur, Agusan del Sur at Occidental Mindoro. Next slide. Sa nakita nating pagtaas ng kaso sa loob ng NCR at sa iba pa nating rehiyon, nais po nating ipaalala sa ating publiko na maaari po nating makontrol ang pagkalat ng virus kung tayo po ay susunod sa ating mga tried and tested protocols. Narito ang mask, ugas, iwas, airflow. Ugaliing magsuot ng face mask sa labas ng bahay, lalo na po sa matataong lugar. Ugaliin din po na madalas at tamang pag-uugas ng kamay. Kung hindi po kailangang lumabas ng bahay, umiwas na lang po tayong lumabas at makihulabilo sa iba. At siguraduhin po natin na maayos ang ating ventilation sa ating mga tahanan. Ibig sabihin po maayos ang daloy ng hangin sa loob ng ating tahanan sa pagbubukas ng ating mga bintana o di kaya mga pinto. We cannot stress enough the importance of our vaccines. Nakakatulong ang bakuna para maiwasan ang pag-mutate ng virus. Gaya nga ng sinabi ng ating mga eksperto, ang virus ay nag-mutate sa mga taong hindi bakunado. Kaya magpabakuna na po tayo at magpa-booster shot po tayo agad-agad. Makakasiguro po ang publiko na patuloy ang kagawaran sa pakikipag-ugnayan sa ating mga local government units para masiguro po natin ang availability ng mga bakuna sa iba't ibang mga areas ng ating bansa. Next slide. Dahil na nga rin sa banta ng pagtaas ng mga kaso na nakita na nating nangyari sa NCR at sa iba pang mga rehiyon, on January 7, 2022, we have conducted a town hall session on managing COVID-19 at home. Kasabay ng ating pagbabakuna at unti-unting pagbubukas ng ekonomiya, mas kinakailangan po natin ang ating pagkakaisa upang siguraduhin ng maayos at walang tigil na pagpapatupad ng PDITR. Ang ating PDITR strategies ay pinapatupad upang epektibo nating mabantayan at mapigilan ang pagkalat ng COVID-19 sa ating bansa. Mahalagang magsimula ang mga initiatives na ito sa ating mga tahanan at komunidad. Sa pamamagitan ng ating paghahanda sa ating mga tahanan, nabibigyan po natin ng proteksyon ang ating pamayanan. Local government units should maximize and activate all telemedicine services to prevent hospital congestion, prepare the isolation and quarantine facilities, and carefully monitor residents who have probable or confirmed cases of COVID-19. Next slide. Para naman po sa mga probinsyang nasa alert level 2 pa lamang, ngayon ang tamang panahon para pabilisin ang inyong pagbabakuna. Patuloy po kaming pinaparating sa publiko ang kahalagaan ng ating pagbabakuna. Lahat po ng ating bakuna laban sa COVID-19 ay ligtas at epektibo upang maiwasan ang hospitalizations at severe impact ng COVID-19. Amin pong hinihikayat ang ating mga lokal na pamahalaan na mas pag-igtingin at palawakin pa ang pagbabakuna upang maiwasan natin ang pagkalat ng COVID-19. Tandaan po natin na more transmission equals to more mutations. Iparating po natin sa ating mga mamamayan ang dagdag na proteksyon na dala ng ating mga bakuna. Next slide. Para lalo mapag-igting ang ating vaccination program, ang ating National Vaccination Operations Center ay magro-roll out ng kanilang tinatawag na res bakuna sa botika. Ito ay partnership sa mga botika at private health companies para lalong mas maging accessible sa publiko ang ating mga bakuna. Kasama po sa effort na ito ang Generica, Healthway, Mercury Drug, Qualimed, Health Network, South Star Drug, The Generics Pharmacy at Watsons. Sila po ay makikipagtulungan sa ating mga local government units kung saan sila located dahil ang mga local government units ang may main responsibility sa registration at documentation ng mga magpapabakuna. Pwede po mag-walk-in ang mga 18 years old at pataas para sa kanilang primary doses or booster shots. Hindi po namin ini-encourage na mag-walk-in ang mga senior citizens o yung pong may mga comorbidities. Ang res bakuna sa botika ay nakaschedule po sa January 20 at January 21. Ito po ay isa lamang sa maraming partnerships ng national government, local government units at mga pribadong sektor para masiguro po natin ang kaligtasan ng lahat sa gitna nitong COVID-19 pandemic. Next slide. Para po sa pahuling paalala, maaring mabakunahan ang ating mga senior citizens, mga buntis at saka mga breastfeeding mothers. Safe po magpabakuna ang mga buntis at saka nagbe-breastfeed. Sa mga nasa kanilang second or third trimesters, hinihikayat po namin kayo na magpabakuna na o kumuha na po kayo ng inyong booster shots. Para naman po sa mga nasa first trimester of pregnancy, kumuha muna po kayo ng clearance nyo sa inyong OB/GYN bago magpabakuna para masiguro na safe po ang lahat. Lahat po ng klaseng bakuna ay pwede sa mga buntis maliban lamang sa Sinopharm at Gamaleya. Pinapaalalahanan din po namin ang lahat na hindi importante ang brand ng bakuna na inyong matatanggap para sa inyong booster dose. Ang lahat po ng bakuna na nabigyan ng Emergency Use Authority ay pinatunayan ng datos bilang ligtas at epektibo sa paghahatid ng proteksyon laban sa malubhang sakit dulot ng COVID-19. Again, while we rely and reiterate the latest data regarding specific vaccines, we maintain that all vaccines, regardless of brand, are safe, effective, and gives protection that they have promised. Next slide. Bago po tayo magtapos, sinisiguro po natin na ang implementasyon ng mga luma at bagong protocols ay makakatulong sa pagsugpo ng pagkalat ng Omicron. Ang mga ito ay para masigurong healthy po ang ating healthcare systems. Pinapaalala rin po natin na kung makakaramdam na po kayo ng simptomas, kaagad po kayong mag-isolate sa bahay at sundin ang proper COVID-19 home care. Mahalaga po ito upang mapigilan natin ang further virus transmission at mutation. Kalinga kits are provided to families in quarantine and isolation. Ang mga kits na ito ay patuloy pong ina-upgrade ng kagawaran habang mas marami mula sa pribadong sektor ang gusto makipag-ugnayan at makipagtrabaho sa Department of Health. Panghuli, ang mga bagong protocols ng DOH ay batay sa pag-aaral ng siyensya. Pinanukala ang mga ito upang mapigilan ang pagkalat ng virus at ang risk na buhat ng Omicron. Hinihikayat po natin ang ating mga kababayan na sundin po ito para sa proteksyon ng komunidad at kaligtasan ng lahat. Thank you very much and over to you, Jazz.
Thank you so much, Yusek, for the very comprehensive presentation and updates po regarding our latest protocols as well as reminders po for the public with this Omicron experience po that we have right now. We will now be moving forward po sa ating pong media questions. that was submitted po yesterday. So you said to the first question po, this question po is from Neil Jerome Morales. And the question po ay, we have seen higher prices in test kits in the Philippines. Is there a test kit shortage issue? And if so, where's the bottleneck po? Is it the suppliers or the distributors? Or is the issue simply a short-term mismatch given a rapid rise of infection in many cases? See, similar question po regarding what is the government doing to address the shortage? Is there any concern of a supply shortage of kits or chemical reagents? Yusek?
Yes, Jas, no? So, Neil, there is no shortage of testing kits nor reagents for our laboratories for the RT-PCR test here in the country. Ang nagkataon lang po, biglang nag-increase ang demand for these laboratory services katulad ng RT-PCR, kaya nagkaroon po tayo ng mga backlogs o nagkaroon po ng pagbagal, no, sa pag-release ng resulta o yung sa pag-access ng mga tao hindi masyado nakapag-access because of the sudden rise in the demand for these services. Pero inuulit ko, wala po tayong shortage. We have enough supplies of testing kits in government and we continuously provide our laboratories with these testing kits. Ang ginagawa po ngayon ng gobyerno ay para magkaroon po ng price caps. No? We are now reviewing, meron na tayong naunang price cap for our testings, testing methodologies katulad po ng ating RT-PCR. Ngayon isinasama na po natin sa pag-aaral din ng antigen test. Magpapalabas po tayo in the coming week siguro, pinag-aaralan na ng Technical Working Group of DOH and DTI. Ito pong bago natin na ikakap sa presyo ng ating mga laboratory test. So aantayin lang po natin yan. Sa ngayon po, medyo nakakahinga na ang ating mga laboratorio. Ang ating pong turnaround time in our laboratories right now is 1.42 days. So hindi na po siya ganun katagal, although of course there would be specific laboratories na medyo nahihirapan pa rin and we are providing augmentation and support to these laboratories. That?
Thank you po, Yusek, for the answer po regarding the shortage of the test kits, Yusek. For the next question po, this is from Rappler, Bondsman Sambol, Yusek. When will the DOH distribute its COVID-19 home care kit po? As you've mentioned po kanina, the January 2021 naman po ito, Yusek. Just to reiterate na lang din po regarding this COVID-19 home care kits or yung Kalinga kits po natin, Yusek.
Yes, Bons. No, itong DOH Kalinga kits, currently we are just drafting the advisory and the guidelines for our implementing units kung paano natin ipinapatupad. But definitely, as soon as possible, magdi-distribute na po tayo. Katulad po ng sinabi natin kanina, ang criteria natin sa pagbibigay, ibibigay po dun sa ating mga vulnerable population na nag-isolate or nagka-quarantine. At pangalawa, tayo po ay continuously na i-upgrade natin yung Kalinga kits na yan as more of our donors and private sector partners will come in and collaborate with us. So, papatupad natin sa lalong madaling panahon, ginagawan lang po natin ng maayos na guidelines.
Thank you po, Yusek. This question po is from Caroline Bongkin po. Which companies or manufacturers already applied for CPR for self-administered antigen test kits? How soon can their application be approved? May usapan na po ba ito with the FDA? Similar question din po from Jenny Ravelo. I would like to ask an update regarding self-administered COVID-19 test kits. Has the FDA advised DOH regarding timelines for when they expect to make decision on the 2 home test kits that have applied for FDA certification?
Yes, Caroline and Jenny, no? So meron na pong nag-apply sa Food and Drug Administration ng mga home administered kits. Ito po ay mga manufacturers, 11 na po ang nakapag-apply. We have to understand the process, no? Kapag nag-apply na po ng documentary requirements ang mga manufacturers or suppliers sa Food and Drug Administration, i-evaluate po ito ng FDA, no? Initial evaluation, and then they will be sending all of this to the Research Institute for Tropical Medicine because the RITM is the office mandated to do performance validation itong mga testing kits. So nagkakaroon po ng performance validation and usually based on the load of work no ng RITM, although they were instructed to prioritize this, it will take them about 2 days, no, or 48 hours for them to finish a performance validation for a specific kit. So having said that, kapag po naipasa na sa RITM ng FDA at pumasa sa performance validation, babalik po sa FDA just to finish the final or finalize the process. Sabihin po natin that within 7 to 10 days lalabas po ang registration or certification nito mga home administered test kits na papasa sa standards ng RITM at saka ng FDA.
Thank you so much, Yusek. Next question po is from GMA, from Lay Alvis po, Yusek. The question po ay, may estimate po ba ang DOH kung ilan ang actual cases ngayon? Ngayong may mga hindi na nagpapatest or nag-antigen na lamang? Or di naman kaya nag-isolate na lamang sa kanilang mga bahay? May trend po ba tayong nakikita sa DOH regarding the growth rate of these cases?
Wala. Nakikita natin yung trend simula pa nung tumaas yung mga kaso, Lay. And actually, as we have said, meron tayong projections na ginawa ng ating faster team para dito, no? So later on, we'll call on our experts. But based on data, I just like to make mention na tayo po ay nagkaroon na ng pagtaas ng ating daily testing output. Meron na ho tayo ngayong 7-day moving average na 80,751 tests per day. Ito po ay tumaas ng about 35% from the previous week. Pero pag tinignan natin, tumaas yung testing output natin, ganun din po ang pagtaas ng mga positibong individuals dito sa ating bansa. Na kung dati po, last week lang, 151,000 lang ang positive individuals, ngayon po, with this testing output, meron ho tayong 262,788. So pag tinignan natin, talagang patuloy pa rin na tumataas ang mga nagkakasakit sa ating bansa. Pero ang tinitignan pa rin po natin kasabay po ng pagtaas ng kaso should be we ensure that our healthcare systems are manageable. At sa ngayon naman po, nasa moderate risk tayo, hindi pa ho tayo pumapalo dun sa threshold na mataas na talaga ng beyond 70% to say that we are at that high risk already for our healthcare systems capacity. So maybe kung pwede nating tawagin ang ating mga eksperto na kasama sa ating call. We have Dr. Edsel Salvania, and then we have Dr. Anna Ong Lim, and then of course we have Dr. John Wong to provide additional inputs.
Thank you, Yusek. Good afternoon to all our media partners. Itong ating Omicron wave is very different, no, compared to yung sa nakita namin sa Delta wave. This morning lang na I was in the ICU with a patient and yung patient actually meron siyang brain bleed, fully vaccinated, pero yung COVID niya is incidental. Ibig sabihin, no pneumonia, ganun. And the rest of the ICU was empty. COVID. Samantala nung sa Delta, nung August and September, halos di kami makaugaga. Punong-puno, ang haba ng pila sa ER for the ICU. Tapos almost all of them are on ventilators. Yung pasyente ko ngayon, hindi lang man naka-ventilator. So ibang pinapakita nito, and I don't think it's necessarily Omicron. It's because marami na tayong nabakunahan. And ito po talaga yung epekto ng ating vaccines plus boosting na nagmimistulang mild na lang for the most part ang tinatawag na breakthrough infection sa COVID. At ito nga po ang ating hope naman talaga na kahit ano pa mang variant yan, basta marami nang nabakunahan, ay nagmimistulang trangkaso na lang talaga yung COVID. At hindi naman tayo nagla-lockdown para sa trangkaso, hindi naman tayo nagte-test ng lahat ng tao for trangkaso. Tina-target lang natin yung testing dahil meron naman tayong gamot kahit mild dun sa mga vulnerable population. So ito yung tinatawag natin na we're moving towards paradigm shift to a new normal, na yung COVID na nagmimistula na lang nga siyang trangkaso as long as bakunado ang nakararami at meron po tayong gamot na pangsalo dun sa mga nagiging severe at critical pa. So ang pinaka-essential talaga dyan is number 1, yung vaccination. Pangalawa, alam naman natin ang bilis-bilis talaga ma-transmit ng COVID. So we really have to try to slow it down. Aside from the fact na ayaw naman natin na sabay-sabay lahat nagkakasakit o na magtatrabaho, ay yung ayaw rin natin na mag-emerge ang panibagong variant na naman. So mga ganitong bagay for us on the ground, nakikita talaga natin na ibang-iba kahit maraming kaso ay because of vaccination, hindi na siya kasing nakakatakot nung dati nung sa Delta na nakikita natin nakapila mga tao, naghahanap ng oxygen, nauubusan ng oxygen, namamatay na lang sa bahay. So iba po siya, hindi ibig sabihin na maging kampante tayo, pero kakaiba talaga yung nakikita namin on the ground.
Dr. Anna, would you want to add something on this?
Yusek, siguro if I can add, picking up on what Dr. Edsel has said, na vaccination has really been a game changer in terms of impacting on the cases that we have, dahil alam natin na ang mga bata make up the majority of the unvaccinated now. Talagang mas marami tayong nakikitang consultations and hospitalizations for kids who are having symptoms of COVID. Siguro what I'd like to add to the discussion is if there's an incentive for us to continue to be careful about our interactions and exposures, it's really because we want the vulnerables in our families to be protected. So lalo na kung meron tayong mga kasamang bata or mga may edad sa ating pamilya, doble or triple ingat pa rin tayo sa ating mga kilos, kasi kung tayo naman na bakunado at malakas-lakas ang katawan because we are healthy adults, ay hindi inaasahang magkaroon ng matinding problema kung mahawaan man tayo. Ang mga batang kasama natin sa bahay o yung mga may edad, pwede pa rin mauwi sa ospital dahil na rin sa kanilang mga kahinaan sa katawan, or in the case of children, kasi nga hindi pa sila inaabot ng ating vaccination program. So I think many pediatricians will bear it out na marami talagang kumukonsulta ngayon at hindi rin kakaunti yung mga na-ospital dahil naapektuhan din sila.
Thank you so much, Dr. Anna. Dr. Wong, would you want to add answers din po?
Sorry, what was the question again?
The question po is related to the may estimate po ba tayo kung ilan ang actual cases ngayon mga hindi na po nagpapatest or mga nag-antigen na lang daw po ang ating po mga kasamahan, at yung iba naman daw po ay nag-isolate na lang sa kanila.
It's difficult to make an estimate, no, because we don't know how many people are actually using antigen tests, no. But I think the important thing is even the RT-PCR test now gives us an idea of the trends, no. The most important thing to know is whether it's increasing, decreasing, or not changing, no. The numbers, although important, no, are less important, no? So even without the antigen test, I think the RT-PCR is giving us important information about the trend of the epidemic.
Thank you so much, Dr. John Wong, Dr. Edsel, Dr. Anna, and of course, Yusek, for answering the question related to the estimation of cases for those individuals po na hindi na po nagpapatest o yung mga nasa isolation. For the last question po that has been submitted po yesterday, Yusek po from ABS-CBN News po, Rafael Bosano po. The question po ay, of the set, a lot of areas or regions are also observing an increase in cases. May the DOH pinpoint the specific areas, regions, and is there any indication that it is Omicron driven?
Yes, no. So as of January 17, we have top 5 regions contributing to new cases. And nakikita po natin ito from the National Capital Region. Nakikita na rin natin sa ibang rehiyon, Region 4A, Region 3, CAR, Region 1. Meron din po tayo na nakikita na high-risk case classification, actually critical, sa Region 2 po. And then the rest of the other regions ay nasa high-risk na. Pag tinignan po natin ngayon ang trends ng mga ibang rehiyon dito po sa pagtaas ng kaso, nakikita po natin yung steep increase in the number of cases dito rin po sa ibang rehiyon. Hindi po natin pwedeng masabi definitely or with certainty that this is really Omicron, but based from our experience here in NCR, we are seeing the same trends in the other regions. But of course, this has to be proven by the whole genome sequencing also.
Thank you so much, Yusek, and those are all the questions that have been submitted yesterday. So we'll move forward to the questions that have been submitted po sa ating pong Zoom chat. Am I clear po, Yusek?
Yes, go ahead.
Okay, thank you po, Yusek. Okay, for the first question po that has been submitted po sa group chat po natin, this is from Johanna from GMA News Online, Yusek. Ang question po, ano po ang comment ng Department of Health sa sinasabi ni Dr. Herbosa na kailangang pababain ng COVID-19 cases by April para hindi maging super spreader event ang presidential election?
Well, this has been a long-standing protocol, no? Na bawal naman po talaga ang mass gathering. Hindi po natin kailangan magantay pa hanggang April para ma-prevent natin ang pagtaas ng kaso. Kung pwede na nating pababain ngayon, pababain na natin ngayon. And then we remind our local government units to enforce, no? Ito pong ating protocols on mass gathering sa ating mga safety protocols. We also remind our officials na tumatakbo po, sana po tayo lahat makatulong namin kayo sa pagpigil, no, ng further na pagtaas ng kaso sa bansa by practicing po ito pong mga safety protocols na meron tayo. I'll call on our experts also to give their inputs on this. Maybe we can start with Dr. Ana and then Dr. Edsel and then Dr. John. Dr. Ana.
Regarding kasi sa mga mass gatherings, of course, alam naman natin na lalo sa panahon na matataas ang kaso, isa yan sa mga tinututukan natin. Kung maaaring maiwasan, malaking bagay kasi makakabawas dun sa mga kasong idadagdag. So, I agree, no? Hindi naman natin kailangan antayin pa yung April. And I guess parang what Dr. Herbosa was pointing out was dahil nga papalapit na tong eleksyon, isa na naman to sa kailangan nating tignan na pwedeng pagmulan ng pagkalat ng sakit. And it's a good reminder for all of us, no, to be very careful about our movements and to make sure that any mass gatherings also implement the proper protocols na pwede na naman nating paghandaan ngayon pa lang.
Yeah, Yusek, I completely agree with what Ma'am Ana is saying. Ito mga alert levels natin, actually dapat nagmimistula na yan, parang yung storm signals na rin natin eh. Na alam natin kung mataas, signal number 3, signal number 4, gagawin natin yung mga bagay na mas nakakaligtas. So kung alert level 3, siguro wag muna tayo mag-mass gatherings. Ganun din, so mas maganda siguro pag umabot yung elections, alert level 1 or at most alert level 2 tayo. So I think that the alert levels really serve as a parang a barometer or yung kumbaga parang senyales na rin sa atin na ganito kataas dapat yung level ng ating pag-iingat at kung abutan nga ng alert level 3 yung elections, mas mahihirapan talaga, magkakaroon talaga ng super spreader event. So it's really up to each of us to contain the spread of COVID, and very important is to make sure everybody's vaccinated. Thank you po.
Dr. John?
So if we look at other countries, no, let's say for example South Africa, no, so for the Omicron variant, the Omicron surge in South Africa is on the way down. No, it took them a month, no, to go from start to the peak, no, but there's several factors working for them. Well, because it's Omicron, no, the virulence is decreased by about 25%. They have high levels of immunity, from both vaccination and natural induced infections, kasi they've had 3 very large waves, and they have a young population, so it's quite short, for them, about a month to the peak. Here in the Philippines, it may take a little longer, kasi we don't have as much immunity. Our vaccine immunity is about 50%, and then our natural infection may probably about 10%. So it will probably take a little longer. Pero I think April is quite a long time, for the Omicron surge. I don't think it will last that long. Maybe a few more weeks after a few more weeks in February. That's probably where we'll reach our peak. Thank you.
Thank you so much, Doc Ana, Doc Edsel, Doc Wong, and Yusek. Yusek, we have a question from Jervis Manahan po, and maybe we can refer this to our expert, Yusek. May recommendation na po ba ang DOH in terms of what mask can be used in the public when outdoors? Given the rate of transmission and the Omicron variant, is it time to require the use of better masks?
Yes, just no. So I will refer this question to our tag experts, Dr. Edsel and Dr. Ana Onglim. Dr. Edsel?
Yes, yung masks actually, even the CDC has already said to wear the best mask that you can get. Kasi yung cloth mask mukhang hindi na siya ganun ka-efficient in preventing yung pagpasok ng Omicron kasi mataas nga yung viral load ng Omicron tapos sobra talaga siya nakakahawa. So at the very least, surgical mask is in order. You can combine a surgical mask with a cloth mask. Yung cloth mask yung nasa labas to improve the fit. Pero hindi po yung dalawang surgical mask, wala pong nadadagdag yun. Or you can wear a KN95 or yung pinakamataas na level, yung N95. Pero pati kami ng mga doktor, hirap kami huminga sa N95. At yung N95 does need some special fitting to maximize yung kanyang effect. Otherwise, parang KN95. And if pangit talaga yung fit, parang surgical mask lang yan. So very important, yung mask is just another layer of safety. If you want, pwede mong idagdag yung face shields as another layer. And of course, yung ating physical distancing, eye protection, kung ayaw mo ng face shield, pwede rin goggles to combine with our masking. So very, very important na we use these layers to protect us, lalo na from this tinatawag natin na hyper-transmissible na variant, yung Omicron.
Dr. Ana?
Sorry, I was trying to catch the question po. Was it about double masking? Sorry.
Yes,
Ana,
Dr. Ana, the recommended mask for now because of Omicron.
Meron kasing mga, so iba-iba kasi yung ginagamit ng mga tao sa community. Siguro yung isang pwedeng i-consider as a practical advice is the more layers you have, the better. So yun na yung nabanggit ni Doc Edsel a while ago, no? Pwedeng mag-isip na magkaroon ng both eye and mouth and nose protection to be able to decrease the chances na makapasok ang virus. So pwede rin gumamit ng medyo mas matataas ang filtration efficacy ng mask, kaya nga siyang may rating na 95 or 94. Yun ang punto nun. Pero siguro yung isang kayang gawin ng ordinary member of the community is to consider double masking as an option. So nasa ilalim yung surgical mask, nasa ibabaw yung cloth mask para yung ating issues with fit and making sure na nakaseal ng maayos yung mask ay ma-address natin. Kasi karaniwan, kung gagamit tayo ng surgical mask, may mga puwang sa gilid. Kung gagamit naman tayo ng cloth mask, baka hindi tama ang ability niya na makasala ng virus. So double masking can be an answer and it's an option that's very doable for ordinary citizens.
Thank you so much, Dr. Edsel and Dr. Ana. Next question po you said from the chat po. This is from Red Mendoza po. Most of those po ba na na-hospital have severe COVID or were infected by COVID pero may malalang sakit? Sa may mga severe COVID, ilan po dito ang unvax? Maybe you said you can discuss po yung mga incidental COVID kung cases.
Yes, no? So, Red, dito sa mga nau-hospital ngayon, may datos po tayo galing sa ating mga ospital dito sa National Capital Region na nagsasabi na around 84 to 85% of those admitted are not vaccinated. And among those who have died, meron ho tayong about 92.3%, no, who are unvaccinated or partially vaccinated. So this is based on our recent data and also based from our data coming from our DOH hospitals. Now, as to the incidence, no, of this incidental COVID na tinatawag, kasi sabi nga natin, dalawang klase na ng pasyente ang nakikita natin sa ospital. Meron pong mga pumupunta sa ospital dahil talaga sa COVID, meron naman dahil sa ibang kondisyon, pero nung tinest sila for screening, bago sila admit, may COVID para rin sila. So we call that incidental COVID. At base sa datos ng ating mga NCR hospitals, 88% of those admitted in our hospitals right now are incidental COVID-19 cases. I'll call on our clinicians, si Dr. Edsel and Dr. Ana, because they see things on the ground. Makakapagbigay po sila ng karagdagang sagot para dito.
Yes, thank you, Yusek. Tama po yun. Actually, lalong-lalo na dun sa mga fully vaccinated na nakikita namin na pasyente, yung breakthrough infection with COVID is very, very mild. May isa nga ako, 80 plus years old, na may sakit sa baga, yung COPD, na long term. Tapos nung CT scan namin, dahil may COVID siya, malinis. pati yung pulmonologist sabi, ano to? CT scan na yon, mas sensitive pa yon kaysa sa X-ray. So these are the kinds of patients we're seeing. May isa pumasok for diabetes, yung isa nag-blockage yung nag-partial gut obstruction siya, masakit yung tiyan, and we diagnosed COVID, fully vaccinated, and then malinis po lahat ng X-rays. So karamihan talaga ng fully vaccinated. Samantalang yung hindi vaccinated na may COVID, karamihan doon, yung severe nila is really because of COVID. Yung isa kong namatay na unvaccinated, sunog talaga yung baga niya. So whether Omicron or Delta, hindi ko alam. Pero ang nagiging factor talaga natin dito is yung vaccination na even if nagkaka-breakthrough, it really turns out to be very mild.
Dr. Ana?
Sa mga bata, actually yung sinasabing incidental COVID, at least from the experience that we've had in PGH as a pediatric referral center, marami kaming mga incidental COVIDs ever since dahil nga na-i-refer sa amin pag natutuklasan silang positive in the process of being cleared for admission, for example, for surgical conditions, or kung kami mismo ina-admit namin sila for other conditions, tapos dahil kailangan namin silang itest, natutuklasan na positibo sila. So matagal na yung finding. Pero I have to say na nito lang kami nangailangan na magdagdag pa ng kama dahil marami ding ina-admit. Again, coming from the fact that halos bata na lang ang hindi bakunado, particularly dito sa NCR. So kung sinasabi natin, may duda pa ba tayo kung ano yung impact ng vaccine? I think looking at the pediatric experience should prove that point eh. Sino na lang ba hindi bakunado? Pediatrics. Sino ba ngayon ng maraming admissions? Pediatrics. So pwede nating sabihin na talagang malaki ang impact, malaki ang naitulong ng pagbabakuna sa pagbawas ng mga nagkakasakit na kailangang maospital.
Thank you so much, Doc Ana. So, Yusek, can you hear me now?
Yes. Can you make it louder, Jazz?
Sorry, Yusek, medyo nagloloko ko yung internet. Yusek, question, we have also question po from Mark Petalco, Yusek. The question po is, can the DOH reiterate lang po ngayon na marami na pong mild cases? How can the public gain access po sa molnupiravir? Thank you po.
Yes, no? So bago ko ipasa uli sa ating clinicians, gusto ko lang hong ipaalala sa ating mga kababayan, yes, molnupiravir is available and you can access that. Pero meron po tayong mga kondisyon para inyong inumin ang molnupiravir. Ang molnupiravir po binibigay sa unang 5, no? Within 5 days from the onset of your symptoms. At kung kayo po ay may high-risk conditions, tsaka po kayo nagpa-qualify to take molnupiravir. Meron din pong mga babala na nakalagay sa label po ng gamot na yan, katulad po dun sa mga women of reproductive age, dahil hindi naman po nakumpleto pa yung mga pag-aaral ukol sa gamit nitong gamot among these specific, no, ng mga individual sa population. Ngayon, for the access of molnupiravir, because it is under an emergency use authority, ang pwede lang hong magbigay sa ngayon, but inaayos po natin ang polisiya to make it more accessible to the public. Pero sa ngayon, ang pwede pa lang po yung authorized po ng DOH, and that would be our hospitals, physicians, no, from our hospital. So kailangan po talaga huwag kayong bumili sa online o di kaya kung sino nag-aalo, kailangan meron pa rin pong guidance ng inyong mga doktor. So I'll call on Dr. Edsel and Dr. Ana as our clinicians also to give a further explanation on the use of molnupiravir. Dr. Edsel?
Yes po, thank you, Yusek. Actually, 3 yung antivirals na pwede nating ibigay sa mga taong may mild infection pero are at risk for severe disease. So ibig sabihin ito yung mga A2, 60 years old and above, and A3 who have comorbids dahil sila yung mas mataas na risk na mag-progress. So unang-una yung molnupiravir, it decreases your risk of hospitalization by 30%. Pangalawa, may bagong pag-aaral tungkol sa remdesivir na pwedeng gamitin sa mild na 3 araw lang as opposed to yung 5 days para sa severe. That decreases your risk of hospitalization if you're in the A2 or A3 by 87%. At yung pangatlo po, yung Paxlovid, it decreases your risk of hospitalization by 89%. So gumagana lang po ito doon sa mga taong, number one, hindi kailangan ng hospitalization at hindi severe ang disease. Number two, within 5 days of the onset of symptoms. At number three, yun nga, dapat nandun ka talaga sa vulnerable population, kasi dun sa hindi vulnerable population hindi naman ganun kataas yung risk ng hospitalization to begin with. So very important, because these drugs are emergency use or compassionate use pa nga yung iba, kinakailangan wini-weigh talaga yung risk tsaka benefit dahil hindi pa nga kompleto yung studies dito, although the studies that we have show na merong benefit as long as you give it in the correct population and at the correct time. Iba naman yung binibigay na gamot namin sa severe at wala pa pong gamot na aprobado para sa prophylaxis or yung hindi pa napupruweba na may COVID. So itong mga gamot na to, again, they are new, they can be used to benefit people, but because they are new, it is very important that the people who know how to use them, the licensed physicians who have experience, are the ones who prescribe them. Huwag po tayo mag-i-experiment.
Thank you, Dr. Ana.
From the pediatric standpoint, very limited yung mga gamot na pwede nating ibigay para sa mga individuals below 18 years old. Particularly itong mga bagong antiviral like molnupiravir and Paxlovid are actually not allowed for use in young children because of some concerns in terms of its adverse effects, no? So ang tanging pwede lang naming gamitin, although yun nga also under EUA, ang remdesivir. So siguro ang paalala ko lang sa mga pamilya na may mga inaalagaang bata na merong mga high risk conditions or yung nabibilang sa A3 na pediatric population, I would encourage na maaga kayong makipag-ugnayan sa inyong mga healthcare providers para makita kung itong mild case ng COVID sa inyong anak or inaalaga ang batang nasa A3 category ay kinakailangang mabigyan din ng gamot dahil meron din kaming mga ganong klaseng kaso na kahit mild, we start them on intervention dahil nga dun sa pagtaas ng risk na sila ay lumala or grumabe ang kanilang kondisyon.
Thank you so much po, Doc Ana, Doc Edsel, and Yusek po. We have remaining 2 questions na lang po. Yusek, this is from Caroline Bongkin po. And the question po is dedicated po for Doc Ana. Yusek, the question po is, ano pong suggested na contingency plan for the coming elections and campaign period po? Maybe Yusek, you would want to answer this po muna.
Yes, we have continuous coordination naman with other government agencies in terms of their activities, specifically with COMELEC, no? Sila po ay humihingi lagi ng guidance coming from us. So we have that, and we will continue to coordinate with them para po mas maayos po ang parating na election. Maybe Dr. Ana can further detail this out. Dr. Ana.
That's right na Yusek. I recall merong mga working groups na naman na kino-convene even from private sector na humihingi nga ng inputs ang COMELEC para kung ano nga ba yung mga proper na public health standards na pwedeng gamitin sa paghahanda sa eleksyon. So actually ngayon pa lang sa registration or even when we go through the actual election process, I think the very critical thing is crowd control. Kasi alam naman natin dun pa lang sa regular na process natin talagang pila at maraming tao. So kailangan isipin kung paano natin maidaraos ng maayos within the time frame allotted, but still being able to control movement of people. And I know that's going to be very challenging. Siguro yung isa lang na naiisip ko offhand ngayon is kailangan din nating paghandaan paano kung dun sa panahon ng eleksyon ay mataas ang dami ng kaso. Dapat meron na tayong handang mga plan B or plan C kung ano man ang ating gagawin, tulad na lang ng nabanggit kanina na parang storm warning itong alert system levels natin. So dahil alam natin na darating ang bagyo, nakahanda na dapat tayo. And that perspective should also be the same with the coming elections.
Thank you so much, Doc Ana po. Let's ask this question din po from Katrina Domingo po, USEC of ABS-CBN News Online. The question po is, Dr. Rogin Solante said that reinfection is possible between 30 and 40 days of unvaccinated individuals. How soon naman po for possible reinfection if in case po vaccinated po ang ating po mga individuals, taking into consideration po yung Omicron variant? Yusek, I will repeat the question, Yusek. Dr.
Yes.
Rogin Solante said that reinfection is possible between 30 and 40 days of unvaccinated individuals. How soon naman daw po sa vaccinated individuals, Yusek?
Maybe Dr. Edsel can answer this, Jazz. Dr. Edsel?
Yeah, yung reinfection kasi, depende rin yan sa mga variants. And we know that the most immune evasive na variants are Beta and Omicron. And then yung sa vaccines kasi natin, kung bakunado ka, tapos nagkaroon ka ng breakthrough infection, ibig sabihin natural infection, we refer to that as hybrid immunity. That's actually the highest level of immunity you can have as opposed to just being vaccinated. Of course, you never want to get breakthrough infection, but if it does happen, then it generally is mild. So your risk of reinfection after a breakthrough infection, fully vaccinated ka and boosted ka is very, very low. For any of the variants actually, including Alpha, Beta, or Delta. Doesn't mean that it's zero kasi lalong-lalo na yung mga taong may immune suppression or may immune deficiencies, pwede pa rin. But the risk is much like 90% lower than somebody who is unvaccinated.
Thank you so much, Doc Edsel. Okay po. Maybe we could ask also Doc John Wong po to give answer po to this question po. Doc John Wong, the question po is again relating po dun sa reinfection of vaccinated individuals versus sa unvaccinated individuals.
Yeah, I agree with Dr. Edsel. Reinfection is possible, but it's very much smaller, no, for people who are vaccinated, no, kasi the vaccine combined I mean, even if there's mutation among the variants, no, there's some commonality, no, in the antigens in the vaccine, so it does still protect you. Thank you.
Thank you po, Doc Edsel and Doc John Wong. Last question po that we can accommodate before we close the media forum, Yusek. The question po is from Red Mendoza. Clarification lang po, Yusek. Confirm po ba yung sinabi ni Dr. Thea na Omicron na ang dominant variant as she explained during the Congress hearing kanina? Yusek?
Yes, Jazz. I'll answer it initially and then I'll call on Dr. John Wong and Dr. Edsel maybe to supplement the response. Unang-una, in the latest WGS or whole genome sequencing run, 97% na po ng mga samples na tinest ay Omicron. So ibig sabihin po, this is predominant currently in this time period that we have right now. Pero pag tinignan natin overall, yun pong most common lineage pa rin sa Pilipinas ay Delta. Pero sa ngayon, this time period, ang predominant na po ay Omicron, specifically, most especially dito po sa National Capital Region, kung saan natin na-detect most of these Omicron samples or cases. So I'll turn it over to Dr. John Wong, and then of course to Dr. Edsel maybe, and then Dr. Ana.
Thank you, Yusek. So in genomic sequencing, is part of the evidence that we're using to determine the presence of Omicron. So it tells us that Omicron makes up a large proportion of the sample sequence. But there are also other evidences. So if you look at the rate of increase of cases from, let's say, December 26 to the present, the doubling rate is about 2. And that's a signature of Omicron. In most countries around the world where Omicron has been proven to be driving the surge, the doubling time is 2 days. So 2 days is equivalent to about a 37% increase per day. The other evidence we have, of course, is even with the very large surge, exceeding that of the Delta surge, our hospitalizations and severe cases remain to be very low. So that's consistent again with the hypothesis that Omicron is driving this surge. Thank you.
Yeah, yung genome sequencing kasi talaga natin, by necessity, meron talagang built-in delay yan. Kasi like ngayon, yung mga nai-infect ngayon, masi-sequence natin yan siguro 2 weeks, 3 weeks down the road. And so yung nakikita natin na behavior on the ground na sobrang daming nai-infect, maraming breakthrough infections, we already knew yung pinapakita na yun was Omicron. But of course, the genome sequencing really just confirms that observation. And tama naman, yung naging assumption natin na Omicron is driving the surge. So this is really something that really just adds to our information and also enables us to say na mukhang community transmission is really there for Omicron, at least in NCR.
Dr. Ana?
Siguro just to add, dahil hindi naman natin nakikita real time kung ano ang tumama sa isang pasyente. Ang alam lang naman natin ay meron siyang COVID. I think hindi pa rin dapat mawala yung ating pag-iingat kasi we never know what will hit us. So hindi naman ibig sabihin na dahil karamihan ng nasi-sequence natin ay Omicron, ay nawala na yung ibang variants in circulation in the community. As was mentioned by Dr. Edsel earlier, may mga pasyente pa rin tayo na malala ang lagay, nadidisgrasya. So I think the message is, even as we recognize that there are more samples being sequenced belonging to the Omicron VOC, the other VOCs are still around and we still need to exercise care, because there's so much transmission going on now.
Thank you po, Dr. Ana, Dr. Edsel, and Dr. John Wong for the explanation po. Okay, maybe we will be asking po again our health experts po na kasama po natin for this media forum to give also their final messages din po and final reminders din po. Maybe they could reiterate, Doc Edsel, Doc Ana po, our isolation protocols and additional safeguards po in the community po. Let's start po with Dr. Edsel, followed by Dr. John Wong and Dr. Ana.
Yeah, thank you. So actually, yung important lang naman talaga natin na intindihin dito is we really have to start to trust our vaccines. Kitang-kita naman na the vaccines are continuing to protect us, and the reason why we are able to modify itong ating mga quarantine and isolation protocols is because we also have more of a safety net in terms of the high vaccination rate in the community. Hindi nga naman makatarungan na sabihin natin kung gawin natin 7 days ang isolation for fully vaccinated, meron pa sigurong 15% residual risk na pwede makahawa pa yan. But why are you going to lock up 85% of people for 3 more days when yung 15% na yon na lang ang kailangan mong bantayan? So we have to balance that out. Locking people up for an additional 3 days also has a cost. And if we know that number 1, ang ating komunidad ay protektado naman, and number 2, sasabihin pa rin naman natin doon after 7 days, mag-mask pa rin kayo, even in the house, pwede naman pong ingatan. We can make these adjustments to make it easier to live with COVID, lalong-lalo na we already have the tools. So number 1, yung vaccines already decrease your risk of dying by 99.9% kung hindi ka sa vulnerable population. Kung nasa vulnerable population ka, siguro from 10% naging 1%. Pero even yung 1% na yon, kung tinamaan ka tapos vulnerable ka, may gamot pa tayong pwedeng ibigay na lalong bababa to 0.1% na parang trangkaso na lang rin. So we have the tools to transform COVID-19 into something that is akin to the flu so that we don't have to close down our society. But hindi yan automatic. Kailangan magpabakuna tayo, kailangan magpa-boost tayo, kailangan tuloy-tuloy pa rin yung paggamit ng mask para hindi po nagkakasakit maraming tao at any time, para hindi rin ganun kalaki yung burden sa society. So it's really a paradigm shift. It's a different world from 2020, 2021 dahil sa bakuna. At let's trust the vaccines. At the same time, continue to be vigilant and do the right thing so that makaahon po tayo sa pandemyang ito. Thank you po.
Thank you so much, Doc Edsel. Doc John Wong.
Thank you. So for those who are, well, for the general public, no, get vaccinated, no, get boosted, no, upgrade your mask to a high quality mask, no, N95, KN95 or KF94. If you're symptomatic, no, assume na you're infected with COVID, no, until proven otherwise, no. Isolate first, no, and then get tested, no? Get antigen tested as soon as possible. When you're released from quarantine, no, continue masking up, no, for 3 more days and avoid crowds and avoid people who are high risk, no, because there's still some residual risk, no, of infection, no. And then if you're infected and if you're elderly or have high risk conditions, no, go to a DOH hospital so that you can access the oral antivirals as soon as possible. Thank you.
Dr. Ana?
Siguro 2 messages lang, no, Jazz. Unang-una, to reinforce what Dr. Wong has said, pagka nagkaroon na tayo ng simptomas, isolate right away. When the symptoms start setting in, nakalamang na ng 2 araw ang virus at nakakalat na yan ang hindi natin nalalaman habang tayo ay umiikot sa ating communities or nakikipag-interact sa ating mga kasama sa bahay. So by isolating right away as your symptoms set in, medyo makakabawas or makakaiwas sa lalong pagkakahawa ng ating mga kasama sa bahay. Pangalawa, yung reminder na pagka tayo ay pinayagan ng tumigil sa ating isolation or quarantine using the shortened protocols, kailangan pa rin nating ipagpatuloy ang pagsuot ng mask habang tinatapos natin yung balanse ng 14 days ng quarantine or 10 days ng isolation. Dahil meron pa rin maliit na risk na pwede pa rin tayong makahawa. Now, because we are a mask-wearing society, ang ating interaction sa labas ng bahay, hindi masyadong problema kasi kung kaharap natin ng ating mga katrabaho or when we commute in public, talagang nakamask naman tayo. Ang pinaka-issue actually is how do we behave at home after we are released from quarantine and isolation. Kailangan medyo may konting pagbabago ng mindset. Habang tayo nag-i-interact with our family members, kailangan pa rin natin ipagpatuloy ang pagsusuot ng mask at umiwas dun sa mga activity na may interaction tayo without mask para makaiwas sa pagkalat ng sakit. Thank you.
Thank you so much, Doc Ana, Doc Edsel, and Dr. John Wong. And for our final message po, Yusek Rosette.
Yes, thank you, Jazz. At maraming salamat po sa ating mga experts, Dr. Ana Ong Lim, Dr. Edsel Salvania, and Dr. John Wong. Maraming salamat din po sa ating mga media partners. Alam po namin, katulong namin kayo sa pagpapakalap ng tama na impormasyon sa ating publiko. Mariin pa rin pong pinapaalala ng Kagawaran ng Kalusugan ang mga sumusunod. upang muli po nating mapababa ang bilang ng mga COVID-19 cases sa ating bansa. Atin pong tandaan na hindi pa rin po tapos ang ating laban. Tayo po ay umiwas sa mga 3 C's na lugar. Yun pong mga confined and enclosed spaces na walang maayos na daloy ng hangin, crowded places na nagkakaroon ng close interaction mula sa ibang tao, at yun pong close contact settings kung saan hindi po tayo makakasunod ng physical distancing. Ang pag-iwas po sa mga lugar na ito ay makakabawas sa posibilidad ng pagkakahawa-hawaan sa ating komunidad. Bagamat bakunado na, huwag po nating kalimutan ang pagsunod sa minimum public health standards. Kailangan pa rin po nating pag-igtingin ng pag-iingat upang makasiguro ang kaligtasan nyo, lalo na po ang kaligtasan ng ating mga inuuwian sa ating mga tahanan. Ang mga edad na 11 pababa ay nananatiling vulnerable sa COVID-19. Kaya labis po dapat ang ating pag-iingat at disiplina. Dapat isapuso po natin itong mga disiplina or safety protocols na to para maprotektahan po natin ang ating mga kabataan at ang ating pamilya. Tuloy-tuloy pa rin po ang pagbabakuna at patuloy pa rin ang panawagan ng ating kagawaran ng kalusugan na magpabakuna na po tayong lahat kontra COVID-19. Sa atin po mga media partners, maraming salamat of course sa laging pakikiisa sa kagawaran upang maiparating sa ating mga kababayan ang tamang impormasyon hinggil sa COVID-19. While we respond to the pandemic, let's also help cure the infodemic o yung pagpapalaganap ng fake news dito sa ating bansa. Pinapaabot din po namin ang walang sawa naming pasasalamat at pagpupugay sa lahat ng ating healthcare workers at frontliners. Hangad at dasal po namin ang kaligtasan niyong lahat na alam po namin na kasama namin kayong tumutugon sa labang ito. Sa atin pong pag-iisa at pagtitiwala sa bisang dala ng ating bakuna, matatagumpayan po natin lahat ito. Tandaan po natin, ang taong disiplinado at may tiwala sa bakuna, may malasakit po sa kapwa. Maraming salamat po sa inyo lahat and please take care all of you.
Thank you so much, Yusek, and thank you so much to all our media partners.